Okay, we're going to go over this. Now, this talk was inspired by a patient, and it's how an adjustment affects the body. Because let's look at the whole thing. Now, we have a normal system. Okay, when you're looking from the front, it should be straight. We're looking from the side, it should be curved. If there's a deviation in that, can you imagine having a reversal of the curve in the neck? Could that affect the nervous system? Because the biggest thing is all the adjustments affect the brain. Now, you got the brain and the spinal cord. And this is so important because it controls every function of the body that it's encased in bone. Now, this nervous system is composed of an autonomic nervous system, which has two parts. And you can say autonomic or automatic, because that's the way it does everything that you don't have to think about. Like, how does your left kidney work today? How is it more than the right or about the same? You don't feel it. No, because this automatic system does it ever. You go from going up, sitting to going upstairs, the heart rate's going to increase. So it does all the function of the body. Now, it does two actions. The sympathetic means fight or flight. It's also called thoracolumbar. The parasympathetic is also called craniosacral because that's where it is. So if we had a cadaver and I was opening up the spine of this patient or person, I could show you what the parasympathetic and sympathetic looks like. You could touch it. It's real. It's there. Now, under these two have similar, they affect similar areas, but in the opposite effect. So digestion, if you're in a stress state, sympathetic, blood supply to the gut's going to shut down. If you're in parasympathetic, it'll increase. Immune system will be decreased in sympathetic, increased in parasympathetic. Sleep will be decreased in sympathetic, increased in parasympathetic. Regeneration is decreased in sympathetic, increased in parasympathetic. Blood pressure goes up here, down here. Cholesterol up here, down here, up here, down here. So it has the opposite effect. So what does an adjustment do? It changes the influence from the body to the brain. That's it. But it's so important because all of these functions, digestion, immune, sleep, regeneration, these are all automatic functions of the body. Now we have this balance of this nervous system. Now, all of these, I know it's a brilliant artist representation of the body. Like you knew exactly this is the vertebrae. Okay, maybe not. Okay, when we take a cross section of this and blow it up, we have the vertebral body, and this is the part called the spinous process and the disc in between. But each one of these joints join in what's called a capsular ligament. So in a normal configuration, it's curved. If you have a reverse or loss of curve, these joints get under a huge amount of pressure. And so when I put it back in place, you get a pop. That's all it is. It's just pressure building up and pressure release. Now so the pop is not the adjustment. The adjustment, we're looking at the muscles that you do not have conscious control. And these are the muscles that run down either side of the spine. They're not under conscious control. You can tighten and loosen these muscles, but you can't tighten and loosen these. They increase in tone under different stimulus. Now, let's say when we should have a normal curve, somebody has a reversal of the curve. Now, is the body smart or smart? Smart. I'm only giving you one choice, okay? But that means that all the muscles that support this are going to tighten up to try and reposition it. So people will say, should I get a massage? Well, if you have a normal curve in the neck, these muscles are going to be in a relaxed state. If you're straight up and down, they're going to be in a relaxed state. However, if we take an x-ray and we see the body off to side one way or off to the other way, that means that these muscles will be an increase in tone. Because remember, you can't tighten or loosen those muscles. They're only going to do that to adapt to some kind of problem later on. Now, So that means that some of these muscles are working harder, some aren't. So what the adjustment is designed to do is to relieve pressure off the central nervous system, change that communication to the brain, and restore normal form and function. Now, a lot of doctors will say, well, chiropractors say the spine is involved in everything. It is. It controls and coordinates every function of the body. Well, all disease can't come from the spine. Really, Hippocrates, the father of medicine, said when confronted with disease, first look to the spine because the nervous system controls everything. So if you can name a disease that doesn't involve digestion, immune system, sleep, regeneration, blood pressure, cholesterol, I'd like to know it because it's all there. So imagine if you had somebody with a reverse curve and a significant left rotation. You think those nerves might be pinched, right? They call that neuropathy. Neuropathy just means pinched nerve. Like when before you gals went to surgeons, they would say, "Oh yeah, you have neuropathy. You have pinched nerve. It's choking it off." Yeah, and it would be. And so what we're doing is we're repositioning this. You hear a whole bunch of pops because that restores normal motion and nutrients get in there. But what does the adjustment actually do? When this is out of position, it sends sensory input to the small brain on the back called the cerebellum. And if you have constant stimulus to that brain, okay, which we do, because remember, this brain needs constant input for the automatic system. It needs input to tell you, should you increase the heart rate? Should you get the digestion working? Or should you run away from danger? So if you have abnormal stimulus to that brain, you're going to get abnormal control of that brain. So this is anxiety, stress, depression, impulse control. So when we're doing the adjustments, not only does it change your brain's awareness of the body, we're literally changing the structure, which is going to change a constant sensory input to the brain, altering brain function. So the adjustments are designed to change the brain's awareness of the body. So it's not out of place, we're not putting it in place. We're changing the position, motion, and communication back to as normal as we can. Now, let's say we have somebody with a reverse curve, loss of curve here, maybe a couple of surgeries, some plates, 3 or 4 accidents. Once you get this as close to normal as possible, should you maintain it? Nah, just wait till it gets really bad again. Of course you got to maintain it. And that's the beauty. But now let's say that you eat nothing but fast food, you work in an office, you have high stress all over the place, you never exercise your body. You're going to have to see us more. Let's say you go to Pilates class on a regular basis, you eat healthy foods, okay? You practice meditation and prayer every day. You're rarely ever going to see me. Okay, can you see the difference? So the pop and crack that we have is just pressure being released. It's not the adjustment. Because like to get these muscles to fire off equally, sometimes I'll just bounce the foot up and down, or I'll move the pelvis a little bit to change that brain's awareness. Instantly the muscles relax. And this is also why the rib cage area, which is where the sympathetic nervous system is, if I adjust that area, you hear a whole bunch of pops from the pressure being released. What's it like to breathe afterwards? What's it like to move afterwards? How does the brain feel? Does it feel more alive? Isn't that cool? So the ancient chiropractors, they said chiropractors work with the subtle substance of the soul, the energy that flows from the brain down to animate and give tissue life. Chiropractors never heal anything. We remove the interference from that brain's communication to the body and the body's communication to the brain so the body can adapt correctly. Is that cool or cool? Okay, now, any questions about this? Yes, ma'am.
When you do the adjustments, Sometimes within a day or two, you get dizzy or headache or...
Oh, heck yes, absolutely. Dizziness, super, super common. Okay. Headache could be because 97% of all headaches are from the neck. Okay. So let's look at both of those. For one, balance. Balance is composed of three things. One, information up the spine to the cerebellum. Okay. Two, the eyeball on the horizon. That's the vestibular ocular apparatus. Okay. And three is the dorsal columns, the information coming up from the back of the spine here, up here. That's the dorsal columns. Now, if you have a normal position of this, you have a normal curves from the side and you're straight up and down, and you get into a big accident that causes this reversal, is balance problems common? Somebody after an accident, they're go, oh, dude, it was a heck of an accident. Common, right? Why? Because that trauma changed the input to the brain. Now, let's think backwards. Let's say that we have somebody that's adapted to a reverse curve. So they think this is normal. No, I'm fine. Why are you looking at me like that? You're going, dude, you ain't fine. Your shoulders over here, your head's forward, you're walking kind of funky. But this, what you'll see when you go to the stores, the people that you work with, you're going to see all of these structural adaptations. So now that person goes to a chiropractor. We do the adjustments. So what do the adjustments do? It's changing the input into that brain. So you go from thinking that this is normal to now your brain has a totally different input. The way I describe it is like we've got a boat. When people get on the boat, their body is sending this information and their eyes are sending this information. If the information from your eyes or the vestibular ocular apparatus, it's like the inner ear system, if that doesn't match the information coming up from the body, then people throw up, get dizzy, balance. It's called seasick. So adjusting an abnormal spine that the person has adapted to, is that going to change the input to the brain? Yes or yes? Changing that input of the brain, will it cause a little bit of adaptation? It could. That's why a little bit of balance issues and everything are common. So if you knew that it happens about 100% of the time, what kind of activities would you give in between the adjustments to solidify the new changes? I got it. How about cross crawl exercises? How about walking barefoot? And if you don't have the grass, okay, just have a weight on the legs and have them swing the legs. And then if you know the brain burns 90% of the body's oxygen, I'd give them movement and breathing. Isn't that cool? Okay, what was the other question? Because that one was balance. Oh, the headache. Okay, good. Okay, now, 97% of all headaches are from the neck. If we have a normal neck, probably no headaches. If we have a reverse or a loss of curve in the neck, and I adjust this to push this back to normal, am I irritating the tissue? Absolutely. Am I creating inflammation at the level of the disc? Absolutely. Because inflammation is how a healing process occurs. That's literally what I'm doing on the discs that the surgeons operated on. Okay? I'm creating inflammation, realigning the scar tissue so these discs can regenerate. So if I'm creating inflammation and changing an abnormal position back to normal, is that comfortable or possibly uncomfortable? Could be uncomfortable. A lot of people find it comfortable. Do I ever ask how you're feeling? Really rarely. Almost never.
Like, if you don't walk on the grass with the weight and barefoot on the treadmill, or sometimes shoes on the street with the...
Yep. When you look at what's the best, second best, third best, fourth best, like some of my patients who are paraplegic or quadriplegics, After the adjustment, I'll have one of their nurses move their arms or move their legs, because even though they can't consciously movement, okay, they're getting the stimulus, they're getting the brain input.
It has to be symmetrical.
Exactly. When one goes up, one goes down. So it's not like this, they're crossing in the air. Okay. And then walking barefoot in the grass with breathing, with weights. So the weights open up the joints, sending more information to the brain. The grass walking, you'll see people with Parkinson's that walk like this. If they have grass or more stimulation, okay, then they can walk like this. We had a patient that went from wheelchair to walking last time we were here, and he was literally taking full steps when we got him weights. And why? Because without the arm weights, this patient, and I think of all Parkinson's patients as having brain damage, they'll swing their arms like this. And I say, no, swing it like this. I am. Okay, because they don't have the awareness of their body and their brain. So they have to see the joints. Then when you put a weight in it, this weight opens up all of those joints, so it gets more information to the brain. So now they can feel in space where their body is. And so the walking barefoot gets them more sensation. That's why the weights give more input into the brain. And if you've been walking crooked like this because your back has been sore or scar tissue or whatever, or adapting to a pathology, and we all of a sudden say, look, walk symmetrically, that's huge. That's hard. Yes, ma'am.
Can you just share a little bit of your children, the orphans, how great their people were?
Oh, okay. Yeah. Yes. This past weekend, we were up at the orphanage. A third of my practice is under 12. Most of them are damaged, neurologic damage. I had a couple of kids that their parents are vaccinated, and I mean all the back. Their kids are healthy. They are just weird. They have different body posture, different movement, everything else. The majority, though, of the kids are walking around like crack addicts, where if you see a normal human being walks like this, these kids are walking around like this. That's brain damage. Okay. And because there's a hypertonic state, and then their shoulders are back and they're walking kind of like crack addicts. The kids up there, even though some of them have horrible trauma, I mean, they've seen their parents killed, they're orphans, the moms didn't have enough nutrients, so sometimes they're born with organs not fully formed. I mean, a lot of different challenges. But their feet and movement was incredible. Like I had this one kid who had his leg broken, I think 7 or 8 times. He broke it in a couple of places, then it healed funky. They had to break it again, and then it didn't heal correct, so they had to break it again. And he's only like 7 or 8 years old. But I had another doctor up there, and I described, because the medical world, like most healthcare professions, ow, it hurts here. Where are you going to look? There. Yeah. Are you going to think that if this is hurt for 5 years, that maybe my whole body weight would adapt to shifting the weight to the other side? If I'm walking crooked, will that destabilize my pelvis? What's in the pelvis? All of my digestive, restoring, and repairing processes. So could a fractured leg cause constipation or sleep disturbances or anxiety or stress or depression? Absolutely. This is why in the segmented healthcare world that we have now, it is impossible unless you have one doctor who does, it's called holistic. Is it just common sense? It's just common sense. There's no holistic. That's why when, well, my doctor says I have this. Okay, good. Why you have that condition? My doctor said that my disc is blown out of place and I have a swollen nerve and it's putting pressure here. Okay, why is the disc bad here? Is it because there have been multiple traumas causing this? You know what I mean? So little detective work. But these kids, their feet were beautiful because they're walking barefoot, running around on grass all the time. They kick their shoes off all the time. I didn't see an iPad anywhere. There's no electromagnetic radiation. We're getting them some refrigerators so they have, better food storage and stuff. But it doesn't matter what trauma they've had. They're running around playing. They're just kids. I've never seen beautiful people. We went to Cuba a few years ago, and I saw these kids walking on the side of the road, okay, in class, all wearing their uniform, but they had the most beautiful posture. And they're holding hands with each other. And I was taking pictures of them. And our guide was going, what? I said, look at the posture. They're freaking amazing. I don't see kids like this in America. It was just, wow. That's why I look at the kids here and I see similar positive posture results. It's fantastic.
I want to know what is prolotherapy.
Oh, prolotherapy is really fun. What that is, it used to be saline, but it could be any kind of irritant. Okay, where if you look at every joint, God, it's almost like we planned it. This was yesterday's talk. Okay, prolotherapy is if this joint is starting to get destroyed. This joint could be a knee joint, shoulder joint, elbow joint, hip joint, whatever. So inflammation is that a healing process of the body? Absolutely. So prolotherapy, they inject it, they irritate it, that creates more blood flow, histamines, and it increases all the cells in here to start to rebuild itself. The problem, and it's also, if you have a ligament attaching this that's damaged, you can inject it and that'll irritate it and it'll increase more stability. Okay, plasma-rich protein like PRP or stem cells are actually injected into the joint. Prolotherapy can be injected in like an AC joint, a acromioclavicular joint, which will shorten it up and help stabilize it. But a lot of joints that have been hypermobile, where they've been beyond its range of motion, you can inject those ligaments and tendons and it'll shorten them up.
So it depends on what they inject you to, right?
Yeah, completely. And that, yeah, it's like prolotherapy is typically done on ligaments, okay, or that connect bone to bone or tendons, which are hypermobile. It's stem cells, plasma-rich protein, sheep cells, goat cells, or sheep and rabbit are the most common. Those are typically injected into the joint, or human cells, umbilical cord cells, and then that stimulates the cells in the areas to regenerate. There was probably ligaments that were strained, and in a whiplash trauma, putting pressure on the brainstem, and that's also why when you're looking at any kind of prolotherapy or anything else, this brainstem is unique. It's the heart, lung, breathing center. It's everything, and any pressure on this area negatively affects the entire body. It puts you into a stressed state where none of this stuff is going to work. So this is why there's about 4 different techniques that only involve adjusting just this bone. So anything in this area is going to affect the entire system. That's why everybody here gets that check no matter what. Okay, 100% of the time. It creates scar tissue to shorten the tissue. So in a damage. The problem I have with prolotherapy or with stem cells, and I've got a clinic that we do our stem cells, or plasma-rich protein, or any injections. If you're injecting any area of the spine or extremities or anything without correcting the problem first, then you're not going to be effective. Yeah, I would never recommend any of that stuff until you fix the problem. And this is the weird stuff, because I mean, for an injection, it's around $2,000 per joint. And getting corrected, you're talking just to restore the biomechanics and the nerve supply, Once you do that, you might not need it because the body's going to regenerate itself. That's why, I mean, I've got my own stem cell clinic, and we don't do the stem cells unless I can assure that they're going to be okay, that they're going to work. Because how many times have you heard, oh yeah, this guy got stem cells and it didn't work? Yeah, because they didn't fix the problem. Well, let's say I've had a knee problem. Okay, now I fractured this knee twice, this one once. Okay, if I fracture this, my whole body weight's going to shift off. That's going to change the mechanics of my foot. It's going to change my hip. It's going to change my whole rib cage area. So if I don't correct physical, chemical, and emotional stress, restore the biomechanics of the foot and calf, stabilize the pelvis, get the knee, the quadriceps to fire off correctly, do everything I can to correct this problem, then do stem cells, then it'll work. But the cool thing is, once you restore everything, you generally don't need stem cells. Any other questions? Thank you very much. Capular.